So bonjour à toutes et à tous. Good day. We'll be updating the national epidemiology and modeling work that we're using to inform the ongoing control of COVID-19 in Canada. But first, I'll just provide the latest numbers. There have been 121,234 cases of COVID-19 reported to date in Canada, including
I'm not getting on.
9,015 deaths. 89% of people have now recovered. Labs across Canada have tested over 4,635,000 people for COVID-19 to date. Over the past week, an average of 43,000 people were tested daily, with about 1% testing positive. Over the last several weeks, national daily case counts have ranged between 350 to 500 cases, with over 375 cases being reported daily during the most recent 7 days.
Bonjour. On fait aujourd'hui le point sur les travaux d'épidémiologie et de modélisation que nous utilisons pour orienter les mesures de lutte contre la COVID-19 au Canada. Pour commencer, je vais vous présenter les derniers chiffres sur la COVID-19 au Canada. 121 334 cas ont été déclarés au Canada à ce jour, dont 9 015 décès. 89 % des cas sont maintenant rétablis. À ce jour, des laboratoires de Par et d'autres du Canada ont effectué un test de dépistage de la COVID-19 pour plus de 4 635 000 personnes. Au cours de la dernière semaine, nous avons testé en moyenne 43 000 personnes par jour, dont environ 1 % ont reçu un résultat positif. Au cours des dernières semaines, le nombre de cas déclarés quotidiennement varie entre 350 et 500 cas, avec plus de 375 cas signalés quotidiennement au cours des 7 derniers jours.
Slide 2, just give an update on the latest epidemiology across Canada. Slide 3. So all jurisdictions in Canada, with the exception of Nunavut, have reported cases of COVID-19, and this is since the start of the epidemic in Canada. So the higher rates are in dark blue if you have the slides in front of you. The incidence rates per 100,000 population illustrate that some jurisdictions and health regions have experienced very limited activity, while others, including the more populous areas, have had more intense activity over the duration of the pandemic so far. So in the boxes to the right, the demographics, so the age, for example, gender, and the severity indicators have remained as presented in the previous epidemiology and modeling update in July.
Merci. Diapositive 2. On va commencer par faire le point sur les dernières données épidémiologiques concernant la COVID-19 pour l'ensemble du Canada. Diapositive 3. Toutes les régions du Canada, sauf Nunavut, ont déclaré des cas de COVID-19. Les taux les plus importants sont en bleu foncé. Les taux d'incidence par 100 000 personnes montrent que certaines administrations et régions sanitaires ont enregistré peu ou pas d'activité, tandis que d'autres, plus peu peuplées, ont été confrontées à une activité beaucoup plus intense depuis le début de la pandémie. Au cours des dernières semaines, les provinces à l'ouest de la bulle atlantique ont signalé des nouveaux cas et des nouvelles flambées. Si on regarde l'encadré dans la partie droite de la diapositive, les indicateurs démographiques et de gravité sont restés tels que présentés dans la dernière mise à jour d'épidémiologie et de modélisation en juillet.
So slide 4. The trend in new cases and deaths reported daily illustrates the decline in COVID-19 activity since the peak in late April. The recent increase in cases since early July corresponds with localized outbreaks and community transmission in provinces outside of the Atlantic region, reminding us of the need to remain vigilant with our public health practices.
Diapositive 4. L'évolution des nouveaux cas et des décès déclarés quotidiennement indique que l'activité de la COVID-19 est en déclin depuis le pic de l'épidémie à la fin d'avril. La hausse récente des cas depuis le début de juillet correspond à des éclosions localisées et à des cas de transmission dans les communautés en dehors de la région de l'Atlantique, ce qui nous rappelle l'importance de rester vigilants dans nos pratiques de santé publique.
Slide 5. To keep a close watch on the severity of COVID-19 infections, we continue to closely monitor the number of cases who are hospitalized and those admitted to intensive care units. Seeing the decline in these severity indicators gives us reassurance that our public health measures are helping to minimize severe illness and deaths due to COVID-19. These indicators have remained low during the month of July, though they have plateaued more recently. Over the coming weeks, we will continue to closely monitor for any change in severe illness patterns.
Diapositive 5. Pour surveiller de près la sévérité des cas de COVID-19, nous continuons de suivre le nombre de cas hospitalisés et de cas admis aux soins intensifs. La baisse constatée des indicateurs de sévérité montre que nos mesures de santé publique aident à réduire les problèmes de santé graves et les décès dus à la COVID-19. Ces indicateurs sont demeurés peu élevés en juillet, mais ils ont atteint un plateau récemment. Au cours des prochaines semaines, nous surveillerons de près pour repérer tout changement en lien avec les manifestations sévères.
Slide 6. The highest incidence of COVID-19 since early July has occurred among individuals aged 20 to 39 years. Although severe illness is less common in younger individuals, they are not immune to severe outcomes. Moreover, transmission in any age group builds a reservoir for the virus that threatens our ability to maintain epidemic control. We do expect to see some increases in the number of daily cases as we move forward with reopening, and it is our collective responsibility to limit the size and impact of these surges. It will be important to keep infection rates low to prevent sparking an outbreak or setting off a chain of transmission that could enter a population or setting at high risk for severe COVID-19 outcomes.
Diapositive 6. Depuis le début de juillet, la plus forte incidence de la COVID-19 a été constatée chez les personnes âgées de 20 à 39 ans. Les jeunes adultes sont moins nombreux à présenter des manifestations sévères, mais ils ne sont pas à l'abri des conséquences graves de la COVID-19. Par ailleurs, toute transmission dans une tranche d'âge donnée contribue à former un réservoir pour le virus qui affecte notre capacité de garder l'épidémie sous contrôle. Nous nous attendons à voir des hausses de nombre quotidien de cas à mesure au fil du déconfinement. Notre responsabilité collective est de limiter leur taille et leur impact. Il sera important de maintenir les taux d'infection à un niveau bas pour prévenir les éclosions et les chaînes de transmission susceptibles de frapper une population ou un milieu vulnérable aux conséquences graves de la COVID-19.
And for those who do see these slides, that's a red line that's on the graphs, the 20 to 39-year-old age group. So the next slide, slide 7. So another indicator of epidemic control is the effective reproduction number, or RT. This number represents how many people are infected by each new case. In order for the epidemic to die out, RT needs to remain consistently below 1, meaning on average, each new case infects less than one other person. Given overall case counts are low, it's really important to note that changes in the daily case counts with the attendant fluctuations in the RT may be a less clear signal of the trend of the pandemic in Canada when national infection rates are low.
Diapositive 7. Un autre indicateur de la maîtrise de l'épidémie est le taux de reproduction réelle, ou RT. Ce nombre indique combien de personnes sont infectées par chaque nouveau cas. Pour que l'épidémie s'éteigne, le RT doit demeurer inférieur à 1 de façon constante, ce qui veut dire qu'en moyenne, chaque nouveau cas infecte moins d'une autre personne. Comme le nombre général de cas est faible, il importe de préciser que les variations de nombre quotidien de cas et les fluctuations du RT qui en découlent ne brossent pas un portrait fidèle de l'évolution de la pandémie au Canada lorsque les taux nationaux d'infection sont faibles.
Slide 8. Settings involving closed spaces, crowded places, and close contact situations pose a high risk for COVID-19 outbreaks. Overall, long-term care and assisted living homes, the red bars, have been hit the hardest, particularly in the earlier months of the pandemic, when over 1,000 separate outbreaks occurred. These accounted for about 20% of confirmed cases and, tragically, over 80% of all deaths. In April and May, a significant proportion of COVID-19 outbreaks were also occurring in healthcare settings and congregate living and work settings, including some very large outbreaks. Following the reopening of social and economic spaces, a smaller number of outbreaks continue to be reported in a wider range of social settings, including food and drink establishments, private gatherings, and parties.
Diapositive 8. Les milieux avec des espaces clos, des lieux bondés et des situations de contact étroit produisent un risque élevé pour des éclosions de COVID-19. Dans l'ensemble, les endroits les plus durement touchés ont été les centres de soins de longue durée et les résidences pour personnes âgées. Ça, c'est les barres rouges. Particulièrement durant les premiers mois de la pandémie, alors que plus d'un millier d'éclosions distinctes ont été enregistrées. Ces éclosions représentent environ 20% des cas confirmés et, tragiquement, plus de 80% des décès. En avril et en mai, un nombre important d'éclosions de COVID-19, dont certaines de très grande ampleur, sont aussi survenues dans des centres de santé et des lieux d'habitation et de travail collectif. Depuis la réouverture des espaces sociaux et économiques, un faible nombre d'éclosions continue d'être signalé dans une plus grande variété des milieux sociaux, comme les commerces d'aliments et de boissons, les rassemblements privés et les fêtes.
Slide 9. This map shows recent trends in COVID-19 activity over the past 2 weeks. Currently, geographic areas with increased transmission, the dark blue areas on the map, include those experiencing localized outbreaks and jurisdictions with previously low levels of COVID-19 activity, such as BC, Saskatchewan, and Manitoba. With COVID-19 activity actively circulating in Canada, new cases or outbreaks can begin anywhere. This means that all areas of Canada must ensure public health, laboratory testing, and infection prevention control measures are well in place to maintain a high level of awareness and readiness to detect and respond to new cases rapidly.
Diapositive 9. Cette carte montre les tendances COVID-19 récentes au cours des 2 dernières semaines. À l'heure actuelle, les régions géographiques à transmission accrue, c'est en bleu foncé sur la carte, comprennent des régions confrontées à des éclosions locales et des provinces qui avaient auparavant un faible niveau d'activité de la COVID-19, comme la Colombie-Britannique, la Saskatchewan et le Manitoba. Comme la COVID-19 circule activement au Canada, de nouveaux cas et de nouvelles éclosions peuvent survenir n'importe où au pays. Cela veut dire que toutes les régions du Canada doivent s'assurer de mettre en place des mesures de santé publique, de dépistage et des mesures de prévention et de contrôle de l'infection pour maintenir un haut niveau de vigilance et de préparation qui permettra de détecter rapidement les nouveaux cas et d'intervenir rapidement.
Slide 10. We are also monitoring the international situation carefully. Very high infection and death rates are being reported in many countries worldwide. Even countries that demonstrated early success have experienced significant resurgences. We are learning from the experiences of these other countries as they also strive to minimize the impact of COVID-19 while resuming economic and social activities.
Diapositive 10. Nous suivons aussi attentivement la situation dans le reste du monde. Des taux d'infection et des décès très élevés sont signalés dans plusieurs pays, même les pays qui avaient initialement réussi à maîtriser la COVID-19 sont confrontés à des résurgences. Nous tirons des leçons des expériences de ces autres pays qui tentent comme nous de réduire au minimum les conséquences de la COVID-19 tout en relançant les activités économiques et sociales.
Slide 11. In today's modeling update, I'll review why we need to continue with critical public health measures to maintain epidemic control, stamp out new outbreaks quickly, and prevent any widespread resurgence of cases. Recall that models provide a prediction of what could happen under hypothetical scenarios, allowing us to drive our public health actions towards a best possible outcome.
Diapositive 11. Dans la mise à jour sur la modélisation aujourd'hui, je vais passer en revue pourquoi nous devons continuer de mettre en œuvre des mesures de santé publique essentielles pour contrôler l'épidémie, endiguer rapidement les nouvelles éclosions et prévenir une résurgence à grande échelle des cas. Il importe de se rappeler que les modèles fournissent une prédiction de ce qui pourrait se produire dans divers scénarios hypothétiques. Ils nous permettent donc d'orienter les mesures de santé publique pour obtenir le meilleur résultat possible.
Slide 12. Based on Canadian data up to August the 8th, short-term forecasting shows predicted cases and deaths due to COVID-19 out to August the 23rd. The graph on the left shows the predicted number of cases could be in the range of 121,650 to 127,740 by August the 23rd. The graph on the right shows the predicted number of deaths could be in the range of 8,980 to 9,115 by August the 23rd. Like the RT, there are important limitations to those forecasts, as it is difficult to predict national case and death counts, which are now largely driven by localized outbreaks and hotspots of community transmission.
Diapositive 12. Fondé sur les données canadiennes en date du 8 août, ce modèle de prévision à court terme indique le nombre de cas de COVID-19 et des décès connexes prévus jusqu'au 23 août. Le graphique de gauche montre que le nombre de cas pourrait se situer entre 121 650 et 127 740 jusqu'au 23 août. Le graphique de droite montre que le nombre de décès pourrait se situer entre 8 980 et 9 115 jusqu'au 23 août. Comme dans le cas de RT, ces prévisions comportent des limites importantes. Il est difficile de prédire le nombre de cas et de décès car ils sont maintenant en grande partie liés aux éclosions localisées et aux points chauds de transmission communautaire.
Just to say, for those of you who are looking at today's numbers, they're tracking along that black dotted line in the middle of that range of estimates. Slide 13. So dynamic models show us that a combination of public health measures will be essential to keep transmission rates low as we continue to resume economic and social activities. Lifting restrictive public health measures, like school and business closures, without strengthening these other controls will likely cause the epidemic to rebound.
Diapositive 13. Des modèles dynamiques montrent que les mesures de santé publique seront essentielles pour garder les taux de transmission bas pendant cette période de relance des activités économiques et sociales. La levée des mesures restrictives de santé publique, telles que la fermeture des commerces et des écoles, sans renforcer ces autres mesures de santé publique, pourrait mener à un retour en force de l'épidémie.
Slide 14. As we continue to lift restrictive public health measures to minimize other health, social, and economic consequences, we expect to see some resurgence in cases, similar to what we've been seeing in July. Until we have safe and effective treatments or vaccines for widespread and lasting control of the pandemic, we will continue to see cases. The key is to keep the infection rate low to limit spread. This is what we mean when we say we're striving for a relatively slow burn to keep epidemic growth under control at all times. Nevertheless, it is prudent to plan and to be prepared for a reasonable worst-case scenario. This type of scenario could include a large fall peak, followed by ongoing peaks and valleys in which resource demands intermittently exceed the health and/or public health system's capacity to manage. Continuing to build up capacity across our health, public health, and laboratory systems, while urging all Canadians to continue with public health practices, will give us the best chance of keeping the epidemic on a slow burn, while preparing us in the event of a need to rapidly ramp up response measures for a possible larger resurgence.
Diapositive 14. À mesure que nous continuons de lever les mesures restrictives de santé publique pour réduire au minimum leurs conséquences involontaires sur le plan social, sur le plan économique et sur la santé, nous nous attendons à vivre une résurgence de la transmission, ce qui pourrait ressembler à ce que nous avons vu pendant le mois de juillet. Tant que nous n'aurons pas de traitement ou de vaccin sûr et efficace pour un contrôle généralisé et durable de la pandémie, nous continuerons à voir des cas. La clé consistera à garder le taux d'infection à un niveau bas pour limiter la propagation. C'est ce que nous voulons dire quand nous parlons de combustion lente, de garder la croissance épidémique sous contrôle à tout moment. Néanmoins, il est prudent de planifier et de se préparer au pire scénario raisonnable. Ce type de scénario pourrait inclure un grand pic d'automne suivi d'un pic et creux continu dans lesquels les demandes de ressources dépassent parfois la capacité de gestion du système de soins de santé ou du système de santé publique. Continuer à renforcer les capacités de nos systèmes de santé publique et de laboratoires tout en encourageant tous les Canadiens à poursuivre les pratiques de santé publique nous donnera les meilleures chances de maintenir l'épidémie sur une combustion lente, tout en nous préparant, en cas de besoin, d'intensifier rapidement les mesures de réponse pour une éventuelle résurgence plus importante.
So the sooner cases and contacts can be identified and isolated or quarantined, the fewer other people they might infect. So the COVID Alert app is another tool that can notify people early of potential exposures and facilitate timely public health follow-up, including contact tracing and quarantine. So far, the number of downloads for this app is 1.9 million. And just a reminder that this is really being piloted in Ontario. So that's the number of downloads as of August the 12th.
Diapositive 15. Plus tôt les cas et les contacts sont identifiés et isolés ou mis en quarantaine, moins ils sont susceptibles d'infecter d'autres personnes. L'application Alerte COVID est un autre outil à notre disposition pour accroître notre capacité d'alerter rapidement les gens sur leurs expositions possibles et améliorer le suivi rapide des autorités de santé publique aux fins de la recherche des contacts et de la quarantaine. Actuellement, le nombre de téléchargements de l'application, c'est 1,9 million et c'est actuellement opérationnel seulement dans la province de l'Ontario. Donc, c'est pas mal, mais on peut toujours faire de mieux.
Slide 16. So each one of us has an important role to play in helping Canada to keep transmission within a slow burn scenario. As we continue with the last weeks of summer, remember what we do now will determine how hard we will have to work in the fall to keep epidemic under control in Canada. We have a shared responsibility to know how to protect ourselves and reduce the risk of spreading COVID-19 to others, particularly those at highest risk of severe outcomes. Thank you.
Diapositive 16. Tous les Canadiens ont un rôle essentiel à jouer pour ralentir la propagation du virus. À l'approche des dernières semaines de l'été, rappelez-vous que ce que nous faisons maintenant aura un impact sur les efforts que nous devrons déployer à l'automne pour continuer de limiter la propagation du virus au Canada. Nous avons une responsabilité partagée de savoir comment se protéger et de réduire le risque de transmettre la COVID-19 aux autres, surtout ceux et celles à plus haut risque de manifestations sévères. Merci.
Thank you, doctors. We will now open the floor and the telephone line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those who are asking questions in the room, we ask that you make your way over to the freestanding mic. We will start on the phone as usual. Operator, over to you.
Thank you. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 pour poser une question. The first question is from David Young-Green from Reuters Ottawa. La première question est de David Young-Green de Reuters Canada. Please go ahead. La parole est à vous.
Yes, thank you. Dr. Tam, I am rather struck by slide 14 when you talk about the reasonable worst-case scenario. Is there any way of quantifying how likely that scenario is or is not going to happen?
That's not an easy thing to do because really the scenario is for planning, but everything, as I've said, is sort of in our hands. So the sort of day by day, week by week monitoring of how well we control things right now will sort of determine the actual outcome. So even the short-term forecasts are subject to all the sort of fluctuations that you're seeing now. So really the take-home message is that, the fate is still within our hands, and what we do now will influence the sort of probability, if you like, of that fall peak. We are, of course, also planning on the fact that other respiratory viruses will generally circulate in that period of time as well, including influenza. So planning for that potential convergence of the viral activity is something that we're actively doing as well.
Thank you, Doctor.
Secondly,
follow-up?
Second, I get a follow-up. Yes, thank you. When you say resource demands could intermittently exceed the public health care system to cope, what does that look like? Is that worse than something we've seen already?
So for planning purposes, what we're asking everyone and the health system to do is, what if it exceeds your current capacity? Do you have surge? Do you have backup plans? So be prepared for that. In the initial wave, you've seen that dotted line, even though that's sort of a planning scenario, you can see that in the initial wave on the whole, Canada, at least at the national level, when we aggregated the numbers, didn't over exceed at least the health system capacity threshold. But it could happen, and we need to sort of prepare for those kind of scenarios. Of course, this doesn't take into account the fact that the most vulnerable populations, including long-term care and seniors, that's where a lot of efforts have to be pulled together. Having learned what we learned in that initial wave, what you don't want is to exceed the capacity of those parts of the society and health system to cope. So everything that we can do now to prevent that, at the same time as having some more surge, having some more resources, having people on the backup to reinforce those resources should that be required, is what we have to do now.
Thank you, Doctor. Operator, next question.
The next question is from Émilie Bergeron from Agence QMI. La prochaine question est de Émilie Bergeron de l'Agence QMI. Please go ahead. La parole est à vous.
Merci. Oui, bonjour. J'aimerais revenir sur un peu dans la même veine que la question précédente. Donc, on parle de percées. On peut s'attendre à des percées. Vous mentionnez ça à plusieurs places, dans la diapositive 6 notamment, et plus tard dans la diapositive 14 quand vous parlez de pic d'automne. Pouvez-vous préciser, est-ce qu'on parle d'une deuxième vague pour monsieur, madame, tout le monde? Qu'est-ce que ça veut dire? C'est une deuxième vague à l'automne et quand à l'automne? Donc en octobre, en septembre?
Merci pour la question. Comme Dr. Tam et moi, on a déjà constaté, c'est difficile à prédire parce que vraiment, qu'est-ce qui va se passer en automne? Ça dépend de le comportement des Canadiens et Canadiennes maintenant, aujourd'hui, aussi dans les prochaines semaines, comme à l'échelle individuelle, mais aussi collectif. Ce qu'on attend pour les objectifs de la planification, c'est que on sait en automne que on attend pour l'hiver qu'on va aussi avoir des autres infections respiratoires, même comme la grippe. Et aussi, avec l'hiver ici au Canada, c'est sûr que beaucoup plus de monde vont aussi rentrer à l'intérieur. C'est des autres facteurs considérés dans nos plans pour planifier pour qu'est-ce qui va se passer. Donc, c'est difficile. On ne parle pas d'une deuxième vague parce que pour nous autres, c'est pas comme un phénomène comme des saisonnières comme la grippe. On parle peut-être éviter une recrudescence des cas à travers le pays. Mais c'est sûr que nous autres, on sait que au fur et à mesure, avec aussi la réouverture, le déconfinement maintenant, les écoles aussi vont ouvrir en automne. Il y a tous les autres facteurs. On n'a pas, une expérience à date et c'est vraiment quelque chose au fur et à mesure. Il faut peut-être regarder qu'est-ce qui va se passer, ajuster comme nécessaire.
Merci, docteur. Émilie, question suivie?
Oui, merci. Donc, OK, je comprends bien que on parle de recrudescence et pas forcément de deuxième vague, mais quelle région du Canada, selon l'information qu'on a déjà en ce moment, ont plus de chances, disons, d'avoir des pics d'automne, comme vous mentionnez, par quelle province, par exemple?
OK. Merci pour la question. Je pense que c'est difficile. Peut-être c'est pas une bonne idée pour moi de dire, OK, peut-être je pense qu'il y a une province ou peut-être une région plus à risque parce que je pense que c'est vraiment tout le monde, tout le Canada. Le risque est pas mal pareil. Mais on peut dire avec notre expérience que on a vu dans les régions peut-être plus peuplées, peut-être les grandes villes avec une densité de population plus grande, que c'est sûr qu'il y a beaucoup plus de risques d'avoir des interactions, plus de nombre d'interactions, et c'est un facteur à considérer. Mais à part de ça, je pense que c'est vraiment important de donner le message pour tous les Canadiens et Canadiennes. Tout le monde, il faut garder et pratiquer toujours les mesures de santé publique. On a déjà répété 1000 fois se laver les mains fréquemment, porter un masque si on n'est pas capable de garder une distance de 2 mètres des uns des autres. Tout ça, c'est très important, renforcer comme un message important.
Merci, Dr. Njoo. Opérateur, prochaine question.
The next question is from Ryan Tumulty from National Post. La prochaine question est de Ryan Tumulty de National Post. Please go ahead. La parole est à vous.
Yeah, hi there. I was wondering if you mentioned that 1.9 million people have downloaded the COVID app. I'm wondering if you can say how many people who have been diagnosed with COVID have used it to alert contacts, and how many contacts, I guess, have been alerted through the app. I guess more broadly, I'm wondering if you're happy with the way the app is working, as an actual contact tracing app.
I'm afraid I can't answer your question, but perhaps the Ontario authorities might have more from that perspective in terms of, I think your question was how many people would have received one of those keys that they put in the phone and alerted people. So at this stage, I can't answer that question. What I will say is that obviously the population of Ontario is just over 14 million, and we now have 2 million people downloading the app. So the idea is just keep going. Actually, I think that's a pretty good result since the start of the pilot, as it were. And I would particularly encourage those who live with their phones, the younger adults, to download this thing, particularly as we've seen with the epidemiology. This age group is more sort of prone to going into certain sort of social situations, pubs, nightclubs, whatever, where you may not know every contact in that vicinity. So download the app is a good idea for particularly that group. But the more people who download it, the more effective it would be.
It's Dr. Njoo. Maybe I'll just add to that. Just to clarify, you mentioned contact tracing app, and I think it's important to distinguish that this is what we call an exposure notification app, because I think if you use that term, some people might get the idea that it actually, quote, replaces the actual hard work of contact tracing. It doesn't. It's another tool to assist in what we still is a resource-intensive activity in terms of contact tracing, real people, contacting real people and, making sure they interview them, identify who they might have been in contact with, et cetera, and so on. So I just want to make it clear that this is another tool, this exposure notification app, but it doesn't replace, and it's certainly, I think, hopefully complementary to the real work of contact tracing. Thank you.
So I guess the other question I would have...
Sorry, Ryan, we're just going to repeat this one in French, and you can have your follow-up right after.
Okay. Je vais essayer, pour répéter ce que Dr. Tam a déjà constaté, je pense que c'est très important. L'app, l'alerte COVID, c'est très important. Je pense que on veut toujours un plus grand nombre de téléchargements. Actuellement, dans la province de l'Ontario, on a une population de 14 millions. On a presque 2 millions de téléchargements. C'est pas mal, c'est bon, mais je pense qu'on veut toujours avoir un plus grand nombre de téléchargements. Et je pense que aussi c'est très utile, peut-être plus important pour les jeunes adultes, parce qu'on sait que les jeunes adultes maintenant, ils sont en général peut-être un peu, pas dire, plus sociaux. Et il y a toujours des rassemblements, peut-être et fréquentent les milieux peut-être comme les boîtes de nuit. Et je pense que c'est une bonne outil si tout le monde a aussi un téléchargement. Si peut-être après, c'est nécessaire de faire vraiment le suivi, le traçage de contact. Si tout le monde ou beaucoup plus de monde, les jeunes adultes utilisent cette app, ça va être très utile pour les autorités de santé publique.
Merci, Dr. Ryan. You can go ahead with your follow-up.
Yeah, so the data you're showing today that shows that even among the 20 to 39-year-olds, the cases are sliding down. I'm wondering if overall you think Canadians are getting the message about hand washing and physical distancing and wearing masks in settings, because it seems like most of the trends are headed in the right direction.
Well, I do think that overall, Canadians have done very well. There is going to be, I think, quite a bit of work ongoing to make sure we get the message to the different populations, whether it be younger adults, in as effective a way as possible. But, right now, I think on the whole, we are on that slow burn kind of trajectory. But it doesn't take much for things to escalate. I believe Dr. Henry, for example, in British Columbia yesterday gave a strong word of reminder, and that there are still some of the population that are not observing some of these rules or public health advice. And so we can always do better. But I'm really, thankful that the majority of the population, I think, are following the public health authorities. Can always do better, I have to say.
Thank you, doctors. We will now turn over to the room. Radio-Canada.
Oui, bonjour. J'aurais une question par rapport aux tests. Bon, là, vous avez dit que vous en faites à peu près 43 000 par jour au pays. On sait qu'il va y avoir la rentrée scolaire bientôt. Donc, ça veut dire plus de contacts. On a vu, par exemple, hier, un cas juste à Québec, un Costco, un supermarché, plusieurs employés qui ont testé positif. Là, il faut que tout le monde soit testé. Est-ce que vous craignez de manquer de matériel pour les tests dans les prochaines semaines, dans les prochains mois au Canada?
Oui, merci pour la question. Je pense qu'actuellement, on continue avec nos efforts au sein du gouvernement fédéral, mais aussi en travaillant étroitement avec nos homologues des provinces et territoires pour la fourniture, pour le dépistage laboratoire. À date, ce que je comprends, on a assez de fournitures et c'est très important parce que ça fait partie de notre planification pour l'automne, pour assurer que avec la réouverture des espaces socio-économiques, il faut toujours avoir la capacité, si on a des cas signalés dans n'importe quel milieu, on a la capacité de laboratoire aussi de santé publique pour sauter tout de suite sur les cas, pour isoler aussi, pour tracer les contacts et faire les suivis aussi avec les dépistages comme nécessaire. Donc, à date, on continue avec nos efforts et je pense qu'on est dans une bonne place maintenant.
OK. Donc, juste pour que ce soit clair, là, vous ne craignez pas de manquer, par exemple, d'écouvillons dans les prochains mois pour faire des tests au Canada?
Pour l'instant, ce que je comprends avec nos collègues ici au sein du gouvernement, on continue toujours à regarder c'est quoi les options pour obtenir peut-être de l'étranger, mais aussi pour fabriquer toutes les fournitures nécessaires ici au Canada pour les dépistages de laboratoire.
Merci beaucoup. Prochaine question, Lina?
Bonjour, Lina Dib, la presse canadienne. Je voudrais savoir, dans votre modélisation, est-ce que vous avez pris en compte les efforts qui ont été faits depuis mars pour préparer, par exemple, le système hospitalier? Quand vous parlez de peut-être une recrudescence en automne et que peut-être le système entier sera débordé, est-ce que vous prenez en compte tout ce qui a été fait? Par exemple, le nombre de tests, les services de dépistage, le nombre de ventilateurs achetés, le nombre d'équipements de protection personnelle qui a été acheté. Est-ce que vous regardez ça quand vous en arrivez à la conclusion qu'il pourrait quand même y avoir une recrudescence cet automne?
Oui, sûrement, c'est fait partie de notre planification à l'échelle fédérale, mais aussi avec nos homologues des provinces et territoires, parce qu'avec notre expérience de l'hiver, de mois de février, mars, avril et mai, on sait mieux qu'est-ce qu'on peut peut-être nous attendre en mois d'automne. Et c'est sûrement le cas que nous avons planifié aussi avec nos achats. Je pense que moi, je suis au courant que même on a acheté plus des respirateurs artificiels et ventilateurs pour les hôpitaux. Donc, même pour l'équipement de protection individuelle, on est je pense, dans une bonne place, on peut dire, avec nos efforts. Et c'est sûr que pour notre planification, pour, comment dire, le scénario, le pire scénario raisonnable, c'est fait partie de notre planification. Merci. Just thinking in terms of planning for the fall, certainly what we experienced during the past winter, obviously from February through to April with everything that happened with the healthcare systems, we've taken that into account. And certainly as we are moving forward with planning, the federal government, obviously with our counterparts, partners in the provinces and territories, we're looking at all of the types of equipment we need, from personal protective equipment, swabs for the laboratory, but also even the equipment such as ventilators for hospitals. And so we're continuing with our efforts to make sure that we obtain, to have that surge capacity. And certainly, as we plan for what we just talked about, what we call a reasonable worst-case scenario, that's certainly part of our planning efforts.
Okay. I'll try in English because maybe my question wasn't clear enough. So my question is, we did some efforts, right, since March. A lot of things were done. Yet you are still saying that in the fall we could get a peak. So have you taken into account all these efforts that were taken to see if in the fall we would get the system would be overwhelmed, although we made all these efforts, all these things were bought, all these things were made. So that's my question. Is it clearer?
Yeah, I'll answer in English. I understood it in French the first time. What I would say is that I think Dr. Tam also mentioned it in her previous answer, is that we know what the experience was in the spring in terms of what we experienced in terms of hospitalizations and so on. We've taken that into account in terms of planning for the fall. As we've also mentioned repeatedly, is that it's hard to predict because for a potential fall resurgence, it all depends at the end of the day on all of us in terms of what our behaviors are now and into the fall in terms of what we might expect. So as we plan for that, we're also looking at the system and we're looking at a bit of a surge in terms of this was the capacity that we had back in the spring. This was the equipment we had in place then. We didn't overload the healthcare system at that point. But in terms of, as you say, plan for the worst, hope for the best, we are actually taking into account the potential of also looking at the surge capacity for the healthcare system so that we are also planning to even have more in reserve, even beyond what was already in place in the spring. Does that help?
Dr. Tam, you want to try a crack at it? Because if we are better equipped now and we didn't overwhelm the system in March, so why would we this time around?
Well, I think it's just preparing for something could happen to this virus. Who knows? Something could change with, we don't know the seasonality of this virus. It's continue throughout the summer, that's for sure. But what if demonstrates a certain type of acceleration under certain conditions? So I think that what I would say is that we are much better prepared than we were before. We are over planning even beyond what we had for the previous wave. And I think that's the prudent thing to do. So this planning scenario is to get all of our partners up and down the health system to overplan. You don't want to get there. That is important. The other aspect of planning for the influenza season is also making sure that capacity isn't being half taken up by influenza-related hospitalizations, for example. We know that normally every season influenza comes around and some seasons are worse than others. And so that red line might not be as much as you would have had in March or April. So I think it's still prudent to overplan, and I think that's the idea.
Thank you, Doctor. Next question, CTV.
Sure. Hi, doctors. Rachel Haynes here from CTV. I'd just like to go back to your scenario about the slow burn, which you have on a trajectory until January of 2022. And has any potential vaccine or the potential of vaccine working played into the planning for this slow burn going all the way until January of 2022?
No, this does not take into account the if it arrives a good vaccine, then that will still have to be taken into account. This is a planning scenario for the health system, but really for the whole society. The concept is just to keep it low. We know that there'll be cases. They come up. You need to put out those sparks. You need to keep those transmission rate as low as possible, the number of contacts as low as possible, so that you can manage it so it doesn't become this sort of higher peaks and valleys. So that is, so you will see that local and provincial health authorities coming into gear. They're now getting more contact tracing capacity, et cetera, so that we can keep it as low as possible. You're not seeing, major sort of up and downs. This could be a very ragged bit of landscape. But the idea is that, you sort of keep it to even below what you had initially in the initial wave so that you can then open up more of your society and your economic spaces. So the idea is to, again, the concept of in this new reality of living with this virus is to be able to open up more spaces while keeping transmission low. So, and everybody, as I said, has a role to play in that.
Thank you. Follow-up?
Yeah, just as a follow-up. So I have two questions, part of the follow-up of, since you're saying the vaccine isn't taking that into account, what would a scenario look like when we do have a vaccine that's effective? And also, given any kind of scenario in January 2022, what can Canadians expect 2 years from now in terms of public health measures? Are we still to be expected to quarantine after travel? Should we be staying home from work for extended periods of time again? Is physical distancing still going to be in place? What will 2022 look like?
I think it would be extremely unwise for me to tell you what 2022 looks like. We are taking almost every 2 weeks at a time. As you've seen, things do surge, and then we see the local authorities coming into play, trying to suppress that. So this is a planning scenario. That's where we want to keep it. If an effective vaccine is safe and effective vaccine is available, then it may depend on how much is available and how effective it is in different population groups. And then, do you need booster doses? How long does immunity last? Those remain questions that we can't answer right now. So the studies and the research on what immunity is generated when a virus infects us, as well as the immunity afforded by the vaccine, still remains to be studied. So unfortunately, I can't tell you what 2022 looks like, but we want to kind of keep it there on the slow burn.
Thank you. We will go back to the phone for 3 more questions. Operator, over to you.
Thank you. The next question is from Antoine Trépanier from Radio-Canada. La prochaine question est de Antoine Trépanier de Radio-Canada. Please go ahead. La parole est à vous.
Vous dites que vous êtes mieux préparé qu'au printemps, mais vous dites aussi de se surpréparer en prévision d'un pic à l'automne. Quelles recommandations vous faites aux agences provinciales en matière de tests quotidiens? Est-ce que vous y allez avec la proportion de la population, un chiffre particulier pour chaque province? Est-ce que vous pouvez expliquer un peu la méthode?
Merci pour la question. Il n'y a pas comme un chiffre magique. Je pense que c'est toujours une discussion. On continue à avoir avec nos homologues des provinces et territoires. Et c'est vraiment pour assurer la capacité, je pense vraiment à l'échelle locale, pour l'éventualité ou la possibilité avec n'importe quel foyer éclosion que la capacité de laboratoire, mais aussi de santé publique, aussi le système de soins de santé, est capable et prêt pour repérer, pour gérer la situation. Si on a des cas, est-ce qu'on peut être capable d'offrir, rendre disponibles les dépistages nécessaires pour les personnes peut-être à risque ou exposées. Donc, je pense que ce n'est pas un chiffre magique, mais c'est sûrement un enjeu actuel et nous continuons à discuter et à travailler étroitement avec nos homologues des provinces et territoires.
Merci. Question suivie?
Oui. Quel constat est-ce que vous faites sur le terrain en ce moment? Est-ce que les gens écoutent les consignes de l'Agence fédérale et des provinces? Puis, parce qu'on voit que les courbes baissent, mais est-ce que pour vous, en ce moment, ça vous encourage? Ou bien, comment est-ce que vous voyez finalement les prochains mois avec le pic que vous appréhendez au niveau de l'attitude des gens par rapport à vos recommandations?
Wow, merci. C'est une bonne question. Je pense que jusqu'à date, on est très encouragés. Je pense que les Canadiens ont fait beaucoup de sacrifices et à date, en général, on a aplati la courbe si on parle vraiment de ce qui se passe à travers le pays. Mais on voit actuellement, c'est un peu comme inquiétant, qu'est-ce qui se passe avec les petites éclosions, les foyers, même qu'est-ce qui se passe en Colombie-Britannique, une province aussi qui a très bien réussi avant avec leurs efforts contre la COVID-19. Mais on voit aussi, et c'est même, pour moi, c'est le même défi à travers le pays. On parle toujours maintenant peut-être des jeunes adultes. On voit que la proportion des cas parmi les jeunes adultes a augmenté et puis aussi avec les rassemblements, les établissements aussi d'aliments, des commerces d'aliments et aussi de boissons. C'est difficile avec l'été parce que tout le monde, je pense que est un peu comme on dit fatigué avec toutes les mesures de santé publique et maintenant avec l'été, on veut profiter parce que notre été, c'est pas très long ici au Canada. Et je pense que peut-être pas de la crainte, mais la préoccupation, c'est il faut toujours, tout le monde doit être, comme on dit, prudent et c'est très important de continuer à pratiquer les mesures de santé publique parce qu'en automne, on va commencer à rentrer encore à l'intérieur. Ça va être quelque chose d'autre et aussi avec la saison normale des autres infections respiratoires aussi, la grippe, c'est très important de continuer avec nos efforts. Ça, c'est, je pense, un enjeu très important pour tout le monde, aussi à être conscient et aussi pour nous autres dans nos efforts de planification.
Parfait, merci, docteur. Opérateur, prochaine question.
Thank you. The next question is from Tonda McCharles from Toronto Star. La prochaine question est de Tonda McCharles de Toronto Star. Please go ahead. La parole est à vous.
Yes, hi. Thanks for taking the call. The question. I'm curious about Dr. Tam, if you could apply some of the modeling that you've looked at to the situation at the Canada-U.S. border today that was extended for another month. How long do you see that situation continuing, given the inability of the U.S. to control the outbreak?
Again, I think it requires continuous assessment because the epidemiology can shift rapidly on both sides of the border. We want to keep our good work, and you've seen from the map that Canada is actually in quite a good position right now. I think it's an ongoing evaluation so that every month when we evaluate that situation again, we'll take into account what's going on both sides of the border. But as we look at further planning out, we have to look at different options of how we can increase safely as possible, international travel, if you like, using different layers of measures to try and reduce the risk of importation and spread, while looking forward to planning for less restrictions. But the key is to do it really carefully and thoughtfully. And so, this is where we're at today, and we'll keep evaluating it until the next decision comes along as well.
And are you in touch then with Dr. Fauci or Dr. Birx or directly with any of the advisors of President Trump in terms of how that country is handling the outbreak? And what exactly is your advice at this stage to the Canadian government? Handling the outbreak.
So I think the sort of state of COVID-19 transmission and activity is, for the United States, is, quite clear. I think there's a lot of information actually available. There's much increase in testing, I think, in the United States, which is showing us that in different regions of the United States, things are not, maybe as well under control. So I think that kind of information is exchanged at programmatic and other levels, on an ongoing basis. But for sure, looking at any differential gradient between the risk between the countries has to be assessed every day as well. But we remain very connected to the United States, the CDC, and others to monitor the situation.
Thank you. Operator, next question.
The next question is from Stephanie Levitz from the Canadian Press. La prochaine question est de Stephanie Levitz de Canadian Press. Please go ahead. La parole est à vous.
Good afternoon. Thank you for taking my question. I wonder if you could be a bit more specific, Dr. Tam or Dr. Njoo. When you talk about exceeding hospital capacity, what do you mean by capacity? Do you mean beds? Do you mean ventilators? What is it?
I think all of the above, but you can, given the jurisdiction is within the province, you can actually see if you go and look into the information produced by the provinces. They are tracking, of course, the acute care hospital bed situation, the ICU capacities, and the ventilator capacities, and also other types of tracking of things like personal protective equipment, for example. So I think all those parameters are tracked. And what we know based on what we learn from other countries and cities that had a devastated impact in that initial sort of wave is if you exceeded that capacity, the mortality goes up really, really high. So that's why you want to keep it below that capacity threshold in terms of activity.
It's Dr. Njoo, just to add to what Dr. Tam has said is that certainly we look at capacity, or we could talk about what we call in-hospital, the admissions and the ICU. But I think overall, if we look at the healthcare system, there's also the concern because we're also looking at, quote, the upcoming respiratory infection season, the flu and other, the colds and so on. And we're looking at, in terms of emergency rooms being overloaded with people with sniffles and colds and fevers, not necessarily because of COVID-19, but also because of all the other respiratory infections. So those are all, I think, other factors in play beyond just, quote, the in-hospital, quote, bed capacity and ICU capacity as well.
Well, and that was sort of my follow-up. To what extent does the influenza season need to factor into this? And do you factor into it when you're looking at things like, do we have enough ventilators?
Yes, so we are planning for a influenza season to coincide with a potential surge in cases of COVID-19, absolutely. We're also, of course, doing a lot of work on prevention. You'll see the annual communication and campaigns about influenza and influenza vaccines. Provinces have overplanned for the requirements for influenza vaccine, for example. And so all of those measures are there to try and reduce the impact of influenza and other respiratory viruses on the hospital system. But I'm also really looking forward to any signs that all those measures that we're doing, the hand washing, the staying home if you're sick, the maintaining the social distancing, wearing a mask in enclosed environments, and when you can't keep this, can also be ways of reducing the impact of respiratory viruses. So we're adding more layers of protection on influenza prevention as well. So it remains to be seen, but we're planning for the fact that, yes, influenza and other respiratory illnesses could take up more beds. The other thing, of course, is to monitor other medical conditions that are non-respiratory virus. And those could also take up hospital capacity in the winter. In Canada, many of the conditions that mortality actually go up in the winter season as well. And so all of that has to be taken into account. And of course, there is the capacity of the public health system itself that we've talked about in terms of testing capacity, contact tracing capacity, the isolation and quarantine capacities. All of those are, are being reinforced and strengthened as part of the planning.
Yeah, it's Dr. Njoo. What I would just add to what Dr. Tam said is, hey, it's summer and it's still early. But I would strongly encourage everyone to seriously think about getting their flu shot when it does become available. I certainly get my flu shot every year, so does Dr. Tam. And so I guess that the question or the challenge out there for Canadians is please consider getting your flu shot this fall as well.
Pouvez-vous répéter en français? Juste à partir du vaccin sur la grippe.
Oui, je sais, c'est l'été maintenant avec le beau temps. C'est pas quelque chose, on pense vraiment maintenant avec le vaccin contre la grippe saisonnière, mais je pense que moi, j'encourage fortement pour tous les Canadiens et Canadiens vraiment pour considérer de recevoir le vaccin contre la grippe quand ça sera disponible en automne. C'est très important. Moi, je reçois toutes les années le vaccin et je pense que c'est une bonne mesure aussi pour se protéger aussi avec la COVID-19. Si on a quelque chose, un autre outil ou un autre moyen pour se protéger contre les autres infections respiratoires, je pense qu'il faut en profiter.
Merci, doctor. We'll take one more question in the room, and then we'll go back to the phone. CBC?
Yeah, David Thurton, CBC. So this question is basically, should the government have moved faster to procure PPE like N95s after documents showed there were warnings about shortages in the national stockpile in early February?
So I think there was a lot of challenges, obviously, in the supply situation globally. But all stops were pulled out to try and get supplies from overseas, but also begin to augment domestic manufacturing capacity. So I think, personally, I think a lot of lessons have been learned. And as we plan for the reasonable worst case scenario, the key is to, as I say, overplan, overstock, and get more of those supplies in as now that we have the summer months, as it were. But, all of those things need to be strengthened as we go forwards.
And I just wanted to go back to slide 14. You see that significant peak in the fall. It is much greater than the peak that we saw May, June, or July, if I'm not mistaken. What is the number at the top of that peak? What's the number that we should be quoting in our stories? Because it doesn't say in the slide.
Yeah, there's no specific number attached to that. So this is not a modeling, mathematical modeling. It is a planning graphic in terms of depicting the fact that we might expect a higher fall peak. I know that, for planning purposes, there's been some modeling done for people.
But it says number of new cases. So there has to be a number there that you guys are using and comparing to make that comparison.
Yeah, so there isn't an actual number, but for planning purposes, some of the considerations are at least looking. It depends on where you were in that first wave as well. Some jurisdictions had very few cases, some had a lot. So for the jurisdictions that had a very high experience with cases, they are planning for several-fold higher than what they had before. But if you were in Nunavut, for example, you may want to plan for 100 times what you had because you actually had very few cases. So it may depend on your local experience as well. But the idea is to plan for something that's at least several times worse than your previous experience.
Thank you, Doctor. We'll go to the phone for 2 more questions. Perry, next question.
Thank you. The next question is from Dan Ralph from the Canadian Press. La prochaine question est de Dan Ralph, the Canadian Press. Please go ahead. La parole est à vous.
Sorry, it took me a while to get off mute. Doctors, thank you very much for your time. Very much appreciated. We know that the Public Health Agency of Canada is in negotiations with the Canadian Football League about the health and safety protocols for its return to play. I'm wondering what the status of those discussions are and if there's a decision forthcoming maybe today on whether to approve or not approve those measures.
Thank you very much for the question. It's Dr. Njoo. So as I mentioned previously, we've had very good discussions with the Canadian Football League in terms of their proposal in terms of health and safety protocols for a potential regular season. As I mentioned before, from my perspective, from a public health perspective, we're quite encouraged. Certainly the model being put forward is similar to, as I would say, the NHL model. It's a bubble concept. I think all the games would be played in the single hub city of Winnipeg. No fans in the stands, no contact with sort of the general population and so on. So I think it's looking very good. So from a pure technical assessment, I think we're very, comfortable with what's been put forward. But there's certainly other elements, I would say, what we call the overall Government of Canada decision-making process. So I can't give you a timeline in terms of that whole process, but certainly from the public health perspective and the assessment we've done within the Public Health Agency of Canada, we're quite comfortable. And I would also add that this also includes the discussions we've had with the Manitoba public health officials as well. From my understanding, they're very comfortable as well with what's been put forward by the CFL.
So, Dr. Njoo, would I be saying that there will not be a decision rendered as early as today, and that this matter may go into next week?
I can't speak to that. I can just speak to the fact what we've done as our part in the quote the overall decision-making process. We've done the sort of the public health assessment in terms of the protocol submitted. They look fine. We're comfortable. We've had back and forth in terms of some questions, and they've been answered well. And I would say that from both Manitoba Public Health and us at the Public Health Agency of Canada, we're comfortable. But as you can appreciate, there are other elements involved. As you can see, for other what we call national interest exemption letters, it's involved different ministers, obviously beyond our own health minister. So that's all I can say, and it's really not for me to speak further in terms of timelines.
We have time for one last question to squeeze in. Operator, go ahead.
Thank you. The next question is from Dave Naylor from TSN. La prochaine question est de Dave Naylor de TSN. Please go ahead. La parole est à vous.
Could you, just a follow up to Dan Ralph's question, when you said you can't give a timeline and there's other concerns, could you in the broadest language tell us sort of what still has to be done for that CFL proposal to be approved?
I wouldn't say there's concerns, but there is a process involved. I can't get into all of the details. What I would say is that we at the Public Health Agency of Canada, we've had good discussions. We've looked at the protocols. We've examined them. We have given suggestions both, in terms of very technical issues like laboratory testing, infection prevention control protocols. We've had discussions with Manitoba health officials. They've also looked at the protocols. They're also quite comfortable. And certainly, I can just say for me personally, along with other colleagues at the Public Health Agency of Canada, we're going to, as they say, prepare a package, have it go to our health minister, certainly with our recommendation in terms of what we think should be done with the proposal. And then, as I said, there are other ministers involved, other parts of the government. I can't speak to, the machinery of government. I can only speak to what myself and others at the Public Health Agency of Canada have done in terms of what our role has been in this process.
Thank you, David. Do you have a follow-up?
I do not.
Thank you. That will be all for today's press conference. C'est ce qui m'a fait la conférence de presse pour aujourd'hui.